Hey everyone, it's Tim Ria here live at the Digital Health Summer Summit with Jeff Margolis, who is the chairman and CEO of Welltok, T-O-K, that's Welltok. How are you doing?
I'm doing great, Tim. How are you today?
Good, good. Beautiful day. Really cool venue. And you guys just came off stage with a panel titled Killer Partnerships, #1, IBM Watson and Welltok. What's your background?
My background, I've been in healthcare information technology for going on 30 years. I hate to admit it. It's just all the good nutrients, I guess. But what I've been doing my entire career is trying to systematically understand how the healthcare system really works, take information technology, apply it in a way that's going to transformatively make a difference and help people and save the system money, make it more efficient, and get all of us doing better.
And how are you doing that? We were talking about there's one philosophy like how are we fixing people's problems versus having a different approach. What's your approach?
Well, that's what you're saying is true. Because health care is so complicated, almost all of the focus in the industry has been on what I call sick care. It's actually sick care, taking people who have something wrong with them, diagnosing them, treating them, and seeing if they'll be compliant to that treatment. And the truth is, we need to do that. And the truth is that in any population of people, if you can't identify and deal with the sickest cohort of people, then you're not going to have an economically viable system. But the reciprocal of sick care is actually optimized health. So for those of us, even if we have a known illness or a known chronic condition, for those of us who are not day-to-day in patient state, but we're going about our lives, we're doing things, we're taking actions large and small, what is out there to help us achieve our highest health status at the lowest cost? Because I think we'd all, if we were asked the question, would you like to be as healthy as you could be, we'd say yes. And if you ask someone, are you getting the right help and support to do that? And are you being rewarded economically? Because remember, for citizens in the United States of median income, healthcare is the second largest out-of-pocket spend after housing, right? And so what we've developed is the Cafe Well Health Optimization Platform so that population health managers like your health plan or your physician group and accountable care organization can partner with you as a consumer and help you align your actions and behaviors to achieve your highest health status and be incented and rewarded for doing that.
Interesting. So what's the relationship with IBM?
So IBM comes into the picture because the entire sick care system of healthcare has been developed around codes that are for billing, essentially. How do you, right? It's about the movement of, right. But if you ask a question like, well, what's the best food for me? I just landed in Chicago. What's the code for that? There isn't one. That is called unstructured data, right? And so what IBM Watson excels at is cognitive computing. You can teach it and train it to understand a person, to understand their health goals. And IBM Watson is spatial. It knows where you are. It's temporal. It knows context of time. And it can then give you advice as a healthcare concierge.
It's a next generation spatial database, plus AI. Interesting. So,
well, what I like to say is, if the last big innovation was search, where you could ask a question and kind of get a list, cognitive computing puts you into a situation where you can ask a question and get a personalized answer for you. Here, now, actionable. So what our layer is if you leave the sick care system for a sec, which is hospitals, doctors, pharmacy, and medical supplies, and now you go into the world of devices, apps, content and education, social communities, condition management programs, fitness and nutrition programs, things that are actionable for the consumer without, if you will, a physician's order needing to be written or an interaction. We provide the platform that allows sponsorship dollars from your population manager partners to be applied so that you can pick and choose the right combination of those things for you. And ultimately, not only are you healthier, but you can get points and rewards that do things like lower the cost of your health insurance, or lower your co-payments, or give you actual reward and incentives to engage in more healthier behavior.
I've heard like in Boston they're prescribing bicycles.
Yeah, exactly. The sort of thing that basically says, what time and place are you in? These are your health goals. How can we put you in a position right now to be your healthiest at the lowest cost?
So, I mean, incredible story there and connections. That's why you get your body down here and not just tune in remotely for the Digital Health Summit. So what's next up for you?
Well, what's next up for us is we're actually putting what I just described into the marketplace here at the end of this year. And we're working very closely with IBM to do that. We've already got 2 initial customers who are going to put the platform into real live usage. And you can find out more about it by following us at welltok.com and watching our news releases. You can follow me on Twitter at _ Jeff Margolis, and we'll keep you posted on LinkedIn and under Optimized Health CEO.
Perfect. All right, we nailed that one. Well, thanks so much, Jeff, and good to meet you, and thanks for your time.
Okay, thanks, Tim.